Our waitlist has truly exploded over the past 8 weeks. We have actually almost 20,000 on our waitlist and almost
Wow.
5,000 pre-orders. Clair is, not just a wearable, it's the first continuous hormone monitor for women. We spent about 6 months doing research on whether or not a continuous hormone monitor would even be possible. We tested it on an internal study of 42 women across 250 plus cycles. And from that, we were able to see that this has the same accuracy as an at-home urine test, which we're super excited about because right now that is the consumer form factor that is available. It's empowering them with information about their own body and hopefully helping them regain some of their agency in the healthcare setting. Women's health has been dismissed for far too long. When we think about entrepreneurship, I think it's really not a zero-sum game. I think that there is opportunity for everyone to succeed. I have this perspective that the world is big enough, and that I think especially in women's health, it now is like a great time to be building. I think we need innovation more than ever, and I'm really proud to be supporting, I think, a movement of new founders who really are passionate about supporting one another and building the ecosystem together.
Jenny, welcome. Welcome to Reclaim. I'm really excited to have you here today and to talk about your new startup and your new wearable product that's coming onto the market.
Thank you so much, Destiny, for having me.
I thought maybe we could start off with your personal background, personal and professional background as to how you got here to building, I think, one of the hottest markets of women's hormone health and also a very hot growing category of wearables.
Of course. So my background is in consumer technology. I've always been fascinated in what makes a brand great and especially what helps trends or companies or brands or movements really shape culture, because I think that is what is at the heart of every consumer product's success. And my last company I worked at was Daydream, which is a fashion tech company. But before that, I spent a lot of time both on an investing lens, looking at companies as a scout for Anthos Capital, but also as an early operator. And I've also spent a lot of time in the creator economy. So did my undergrad at Stanford. There I built a creator incubator, Next Creator Collective, and got to learn a lot about how creators in the creator economy also drive consumer purchasing decisions. Beyond that, spent a lot of time, again, consulting early stage startups from ed tech to health tech, and also helped launch a movie on Paramount. But my interest in women's health really, I think, starts even actually in high school, but more on the nonprofit side. I spent a lot of time working with nonprofit organizations. Most significantly was really involved and still am very passionate about this organization called Rosehaven in Portland, Oregon, which is where I'm from. It's a day shelter serving women and children experiencing homelessness and domestic violence. And from there, I kind of first got to see the struggles that some women experienced, either getting access to healthcare services or more often feeling dismissed within the system. And that was just a pattern that I saw repeated over and over and over, not just within this community, but also through my friends and my family. And I think historically there's been a trend of healthcare treating women like smaller men. This is echoed throughout both clinical research as well as even the way we prescribe and treat conditions. And I think it came to a point at Stanford. I was taking this class looking at the general funding ecosystem, looking at the state of women's health research truly, and just seeing this massive gap in data in women's health. And I think the fact that, it's the 21st century and we still don't understand even how some of the most basic or most common conditions like cardiovascular disease affect women just was extremely shocking. And I think came to a point where I just realized like I had to do something about it.
Wow. I love what you said about women being treated like little men, not the fact about it, but I thought it was so well described and a recurring pattern around the journey of women's health, right? Whether it's perimenopause, menopause, fertility, postpartum. And I'm curious about your conviction in terms of you saw this problem, it was coming up for you, you're seeing it firsthand. And I guess, like, have you always had that conviction to say, I'm going to solve this and I'm going to lean into building a startup and a product that's going to solve this? Or was there something else that kind of came up along the way? Because it's not, this isn't, it's a big initiative that you're taking on, I guess is what I'm trying to say. Yeah.
Yeah, I guess I have to admit personally, I never sought out intentionally to become a startup founder. I've always been really drawn to high stakes environments. I actually, when I was in college, I thought I would become a trial attorney, and I really wanted to work on women's health cases, more on the court side. So, women's rights and awareness around that. Actually, in college, I spent a quarter in Washington, D.C., working at a think tank and doing policy based research. So, I really did think I would go down that path. But when I was in my last year at college, around that time, I met my co founder, Abhinav, who has a background in health tech, specifically in wearables. And so we spent just a lot of time talking about, frankly, the state of the healthcare system and what is missing in terms of this, I think, this massive gap between what people care about, the information that they collect on a personal level through other wearable devices, through blood testing. I think companies like Function and Superpower have really informed this age of personalized medicine, but where the healthcare system is still lacking in terms of treatments, in terms of integrations, and more. And the more that we spoke, I guess the more it became apparent that, first of all, there's again a gap in the way that wearables have made information personalized, and then the way that the healthcare system is able to take in that data. And then on the other side, a gap specifically in women's health. And I believe that hormones, especially these four hormones, estrogen, progesterone, LH, and FSH, are the operating system of the female body. And yet, there's no way to look at them continuously. So the last company my co-founder was working at was a continuous glucose monitoring company. So actually building the first non-invasive CGM. And so I guess through that experience, and even in the clinical trials he was working on, saw that women were really interested in getting this data, both on glucose and on insulin, and understanding their health from that perspective, but also how hormones impact all of that, and weren't getting solutions there. So we spent about 6 months doing research on whether or not a continuous hormone monitor would even be possible. We looked at all different form factors, everything from the needle patch solutions that sort of CGMs have pioneered to even sweat-based solutions, saliva-based, and more, and eventually came to the conclusion that we could build something non-invasive, but also, precise and accurate for women. And after we came to enough conviction on the technology itself, we decided to both go full time. I ended up graduating early, and he left his previous company, and then we went all in on Claire.
Wow. So I guess this is a great segue to go into what you've built, right? And you started to talk about this, but tell us, or I guess maybe unpack for us what it's tracking, how many biomarkers, and the testing that has been done to date to verify its precision and accuracy.
Yeah, so Claire is, not just a wearable, it's the first continuous hormone monitor for women. And this is what it looks like. I'm actually wearing one on my wrist right
Very
now.
pretty. And it's
Thank
about the
you.
size of an Apple Watch. Is that accurate? Okay.
Exactly, yes. And the way that we're looking at this approach, and what really makes us different, is we don't look at any biofluids at all. So we don't track sweat, saliva, blood, etc. And we're really looking at a biophysical approach at modeling out the hypothalamus pituitary ovarian axis in women. So we've constructed a series of equations that's able to accurately model this, and we track estrogen, progesterone, LH, and FSH. So in the app, people get continuous access to this data, as well as, we have feature parity with other wearables. So they're also getting their sleep, their fitness, activity, and especially how hormones relate to and affect all of these upstream signals. In terms of validation, we tested it on an internal study of 42 women across 250 plus cycles. And from that, we were able to see that this has the same accuracy as an at home urine test, which we're super excited about because right now that is the consumer form factor that is available. So that was our initial validation. Now, over the summer and beyond, we're going through more clinical grade validation to confirm its accuracy in relationship to blood serum results. And what this would unlock for us is more clinical grade insights beyond just what consumers can see sort of on an everyday level. Because, again, one of our goals with the company is to really be able to bridge this gap between what consumers have access to in terms of information, and then also information that is high fidelity, high quality, and useful for providers as well, to address a lot of the gaps in the care layer and point of care layer for patients and users down the line.
When you enter the market or when you launch in the fall, are you going direct to consumer or are you also parallel pathing with working with clinicians and practitioners? I'm curious about the market strategy.
Yeah, so it's both. We've seen, a lot of interest from consumers and we are retailing direct to consumer, but beyond that, we do have relationships with clinics, with distributors, etc., and both, in the US and internationally, which we are also partnering with.
Interesting. Okay, got it. Very cool. So, wearables have been tracking or collecting data on heart rate, your body temperature, tracking HRV. And I'm curious, in your opinion, why that hasn't until now been translated to actually tracking our hormones and giving us valuable hormonal insights, given its impact across, fertility, trying to get pregnant, postpartum, perimenopause. Yeah.
Yeah, I think, there's a couple of dimensions here. I think, first of all, most wearables in the market are generalizable. We're actually, to my best knowledge, one of the first wearables that is specific to women's health and to women. And what generalized wearables miss out on often is they filter out all of the sensitivity and this often hard to listen to data as noise. Because generalized algorithms, even on things like arrhythmia detection or cardiovascular insights on HRV, they have to work for both men and women on these generalized wearables. So a lot of the female specific signals are, they just get filtered out. So I guess that's the first domain. Second thing is most wearables actually only have 3 or 4 sensors. We have 10 sensors, and with that, we capture over 130 different biomarkers. So I think that, as wearables continue to develop, a lot of this technological maturation has, in terms of the sensors themselves, has only happened in the past 3 to 4 years. And a lot of these wearables have been in development for 10 years. So it doesn't make sense for them to, I guess, completely change their architecture of their devices to account for this, like, I guess I don't think women's health is niche, but I guess in terms of the population, maybe half the population rather than the whole population. I think, at the same time, we are continuously pushing the boundaries of what wearables can do. There was a time where we weren't even sure if it was possible to track HRV or even heart rate with wearables, and now that is mainstream. I think that the main challenge, moving forward, tracking things like glucose, tracking things like hormones, and what wearables will push forward is, first of all, this huge data gap, being able to collect a high fidelity of data, and then obviously the innovation in terms of the algorithms, in terms of the sensors themselves, and what those can tell you. So, I think it's both a promising field, but also quite challenging, given that it's not just the fact that you can put more sensors into a device and assume that it works. It's about, the exact arrangement, how those sensors communicate with each other, the algorithms that support the analysis of all the data that comes in, and then, of course, being able to fit it into a small enough form factor that's available to consumers.
I can get that. And that makes a lot of sense because with a wearable, you actually have to update the product itself
Mhm.
versus if it was software driven. That totally makes sense. I think in terms of like the next step, and you started to speak to this in terms of synthesizing the insights and actually analyzing the data and drawing insights. So we're tracking, and now we have all this data. And so, what is happening for your customer or your consumer with how they're using it? Is this getting parsed into their personal goals? Or is it just starting from a bigger picture? I'm kind of curious as to what's built in for like what's next.
Yeah, so with Claire, all the information is translated into a mobile app. And I think the biggest opportunity right now with health apps in the future is a high degree of personalization. I think technology has enabled this, with people having access to ChatGPT, to access to Cloud Health. A lot of people are consistently pulling in data from all sides into platforms like these. But I think where these LLMs miss out is being able to understand information beyond just language, beyond just internet or Reddit information, but multimodal data. So these are physiological data points alongside voice data, alongside user self-reported symptoms, even alongside clinician notes. And I think that's where our app really comes in, because we're able to see such a large quantity of physiological information, obviously beyond hormones, but looking at these other signals in the body, we can create a highly personalized experience where we don't just give them the data, because I think my intuition is just that pure data dumps are not helpful. It's really in context where they are helpful. So not just giving them, their hormone information, but really helping the end user understand how that impacts, say, their mood, how that impacts their strength training, if they're an athlete, how that impacts the symptoms that they might be experiencing for perimenopausal women, how that interacts with the medications and maybe some of the other conditions that they have, like PCOS, endometriosis, and more. And so one thing that we're super excited about in the context of our app is that users will be able to access tools to basically plan anything that they want, like marathon, everything from marathon training to nutrition training to asking what supplements that they want, kind of as a series of mini agents or mini tools within the context of our app themselves. So the goal is that all of their health information, pulled from Clair, pulled from these other sources, can live easily on one platform without them having to export the data and then putting it into something like an LLM later down the line.
That's cool. So all the data is getting extracted, captured, and monitored. And then the user is able to go in and say, I want to create protocols or I want insights against XYZ, to your point, marathon, maybe planning for having a baby. And then that spits that out for them. Is there like a top line in terms of it calling out flags or signals, or is it really driven by the user and what they're looking to create protocols for?
Yeah, I mean, I think it is, driven by the user, but we are able to flag, say, if the cycle is irregular over a consistent period of time, if we've noticed that if a person, one of their goals might be trying to optimize for fertility, and if their progesterone is consistently low, that's actually quite a common cause of infertility that many people don't realize. And so being able to flag things like that early on so that they can get interventions, or at least be aware of how their body is changing, because I think one of the biggest problems is that women's health symptoms are often dismissed, whether they talk to a doctor, whether they search online. I think there can be a lot of instances where women feel like they know something about their body, but they don't have the data to actually quantify that, and then their symptoms or their feelings are not often taken seriously. And so being able to have access to that data and being able to on a quantifiable level know what's going on, I think can be really important to seeking care, seeking treatments, or even lifestyle interventions down the line.
Yeah, yeah, that's clear and makes total sense. So, building in this early stage, especially for founders who are listening, and also building in this stage, what would you say has been an unexpected learning or even a pivot that you've had to make so early on?
Yeah, I mean, I guess in terms of unexpected learnings, I think there's always learnings, and building hardware is uniquely challenging. There's a lot of domains to stay on top of, be it manufacturing, be it the actual design of the device itself, software, and also, of course, making sure that users are interested in it. I would say potentially like the unexpected learning is just, I think, how much interest and how much support there is from the community in terms of other founders, in terms of resources out there. I think that when we think about entrepreneurship, I think it's really not a zero-sum game. I think that there is opportunity for everyone to succeed. I have this perspective that the world is big enough, and that I think especially in women's health, it now is like a great time to be building. I think we need innovation more than ever, and I'm really proud to be supporting, I think, a movement of new founders who really are passionate about supporting one another and building the ecosystem together.
Yeah. And is this showing up in terms of partnerships with other women's health companies where you're adjacent together, or is it founders supporting founders? I'm curious, or like maybe both, but yeah.
Yeah, I think all of the above. I think in terms of partnerships, definitely in terms of founders supporting founders, and then just like even the way the community shows up for each other in terms of like support online on social media, or even like pre-ordering devices, or just being super excited that women's health is moving, I think, finally in a more positive direction as a whole.
Yeah, great. I love that. And I would agree. Like when I've been to women's health industry conferences, the environment feels particularly supportive, right? Across operators, founders, partners. So where are you in so when is it launching in the fall? And I guess talk to me a little bit more about what the process is. Is there building up organic community? Who are you expecting your first customers to be? Because the other thing I see about this is that because it is so wide ranging and the amount of data it can collect, there's different entry points where a woman can come through. And so Like, who are you speaking to? And I'm curious if that has been firmed up or shaped up since we're not quite to fall yet.
Yeah, so we're shipping our devices in November, and so far we've seen the most interest from the perimenopause as well as the fertility, so trying to conceive segment. Although there's also a lot of interest from the PCOS and also general longevity biohacking community as a whole. So I would say those are the primary groups where we've seen like the most, at least pre-order volume in. But I think the goal for Claire is to truly be a device that supports a woman throughout her entire life stage. So I think that is the end all be all vision for the company and where I see it going in the future.
Interesting. And so right now, are you building up? Because it looks like you're building up a wait list. I mean, are folks able to place an order right now, or is it more waiting to get introduced or having that opportunity?
Yeah, so we do have a wait list, and then we also do have pre-orders open. We're also FSA eligible, so they can use their FSA dollars, but beyond that, can put in a small deposit now and pre-order the device for 50% off when we ship.
Got it. But I'm curious if want to go into like how large the wait list has been, how many pre-orders, like what's been your marketing so far? Is it through influencers?
Yeah, so we have seen a lot of growth in terms of social media traction, organic growth. We also have been obviously in podcasts and in news, so I think that's been a major driver of growth too. But I definitely think that social media and organic discovery on LinkedIn through word of mouth and online has been the primary driver of growth. We are super excited. Our waitlist has truly exploded over the past 8 weeks. We have actually almost 20,000 on our waitlist and almost
Wow.
5,000 pre-orders. So I think we're super excited about the way that people have shown up, have expressed interest, and hopefully the momentum that will continue.
Now, the growth marketing side of me is very curious. Through primarily organic efforts, you have 20,000 folks on the wait list and 5,000 sold.
Yes.
I am so impressed. 5,000. Wow. How much traffic have you driven to
Our
the product? I mean, I am so impressed given that it doesn't what I'm thinking about is because the product doesn't ship till fall or until November. What we have found is a lot of times folks don't want to wait so long. And so I'm kind of curious as to what has been such a strong motivator. Like, yes, 50% off is strong, but for a new product in a new category, that's impressive.
I think women have been waiting too long for solutions to truly serve them. I think, wearables on the market have done amazing things for sleep, for fitness, activity, and more. But I think women's health has just been quite, an overlooked space for a long time. So I think, people really underestimate the demand and underestimate the need that women have expressed for products like this. I think it is something from speaking with their community that women have been asking for truly time and time again. And yet I think no product has really, no wearable at least has expressly come out with this focus on women's health as a whole. I think women are looking for that. And then, yeah, I guess just in terms of growth, like our Instagram receives, last month they received 1.2 million views. So I think
Wow.
that is quite a big driver of traffic for us.
I'm so impressed. And zero paid effort so far.
No, yeah, we haven't done paid.
I am so impressed. I mean, I did see that in your funnel you had the $1. Like, I
Hmm.
mean, I think that's very smart because you're still asking for a commitment, but it's still a minimal commitment. But wow, I am blown away.
Thank you.
Congratulations.
Thank
That's
you.
so exciting. Yes. Well, we've been kind of talking about upcoming product being released in the fall. What would you say in terms of like what's next with defining success metrics and milestones? Is it, FDA clearance, although that could be further down the line, like kind of what's next and what's being thought about in terms of next stage of success?
Yeah, I think what immediately is next is really nailing that app experience for an end user. I think that is, very important to, I think building hardware is one dimension, but beyond that, it's being able to deliver actionable insights, personalization, and really adding value to an extent that people want to keep using Claire. They want to keep learning that we're actually like supporting them in their day-to-day lives. So that's the most immediate priority right now. And I think beyond that, we are looking into the FDA claims and also trying to support more medical use cases as well and working really with providers to build out that network.
Yeah, I love that. Actually, I was going to ask about this when you were talking about the product. Like, where in the process was it clear that it was going to be on the wrist? Is it because the user adoption, like we're so familiar with the Apple Watch right now? Is it because of the size? Like, I'm curious, like how that got defined and like when in the process.
Yeah, I would say pretty early on. One of our goals while creating Claire was to make it the most jewelry-like form factor possible. That's part of the reason why we don't have any screens on the device. And we looked at a lot of different form factors, actually everything from rings to earrings to
Right?
necklaces, armbands, and more. And what we found is that really to get the fidelity of data we need, as well as the number of sensors that's necessary for this device, a wrist is the smallest form factor possible. So we I believe that with a ring or earring or anything smaller, we wouldn't be able to fit essentially the number of sensors, all of which are necessary for this use case.
That makes sense. Got it. Great. Well, this podcast is called Reclaim. So, one of the questions that we like to end with is what are you helping your customers and your patients reclaim through your product?
I think it's empowering them with information about their own body and hopefully helping them regain some of their agency in the healthcare setting. I think women's health has been dismissed for far too long. There's sometimes medical gaslighting. There's these instances where women feel like they know something about their body and that healthcare isn't reflecting that knowledge or that awareness. And so I think it's being able to give women access to their data that their body has always had and just giving them a point of visibility into that and helping them reclaim that.
I love that. So well said and so well captured. Well, thank you, Jenny. Thanks so much for your time today. I really enjoyed this conversation and diving into new product innovation and new category. And I'm really excited to share this with our community.
Thank you so much.